Imagine this. You walk into a hospital, as you have probably done many times before. The hallways are busy, people are waiting patiently, or sometimes impatiently, for their turn. You are referred to a specialist, undergo a series of tests, and then the waiting for results begins. This is the reality of today. But what if I told you that this world of healthcare, as we know it, is on the verge of a complete transformation? What if medical breakthroughs that seemed like science fiction just a few years ago are now within reach? Today, we invite you on a journey through the most groundbreaking innovations that will define the future of healthcare. Let's start with a technology that can literally create life: bioprinting. This process has the potential to completely change the way we perform organ transplants. Instead of relying on scarce organ donors and facing the risk of rejection, we may soon be able to print organs. Yes, you heard that right. Print them. So, how does it work? Bioprinting begins with collecting living cells from the patient themselves. This is crucial because using the patient's own cells drastically reduces the risk of rejection by the body. These cells are then placed into a gel-like substance known as bio-ink. This provides the structure and strength needed to form the organ. This bio-ink is made up of various materials, including hydrogel, which, in combination with the cells, forms the building blocks for new tissues and organs. The printing process is similar to 3D printing, but instead of using plastic or metal, it employs a combination of living cells and bio-ink. Layer by layer, the cells are precisely positioned to form the desired organ. This is done by an advanced bioprinter that meticulously builds each layer based on a digital model. This model is often created using the exact anatomy of the patient, ensuring that the printed organ fits perfectly within the recipient's body. But bioprinting organs isn't just about printing cells. One of the biggest challenges is creating blood vessels within the printed organ. Blood vessels are essential as they deliver oxygen and nutrients to the tissue, which is necessary to keep the organ alive. Researchers are working hard to develop techniques to replicate these complex networks of blood vessels in printed organs. This is the key to ensuring that the organs can function properly once implanted into a patient's body. What makes bioprinting truly revolutionary? Imagine a patient urgently needs a new heart or kidney, but instead of waiting months for a suitable donor, the required organ can be printed within days. No more long waiting lists, no fear of rejection. The ability to create organs that perfectly match the patient is a game changer. Worldwide, thousands of people are waiting for a new heart, kidney, or liver. For many of them, the right organ arrives too late. Bioprinting can change this reality forever. There have already been impressive breakthroughs. In 2019, Israeli scientists successfully created a 3D printed heart, complete with blood vessels, albeit on a small scale. Examples like these give hope for a future where waiting for donors becomes a thing of the past. Scientists have also successfully printed skin, bones, and even parts of complex organs like hearts. In some cases, these printed tissues are already being used in experimental treatments, such as for burn victims or reconstructive surgery for bone structures. Bioprinting demonstrates how technology can completely transform healthcare, but it is just one part of the innovations that will shape the future of care. Another technology already being widely applied is artificial intelligence, AI. While bioprinting focuses on creating new physical solutions, AI helps us recognize diseases faster and more accurately. Picture this. You walk into a doctor's office, and AI assistants analyze your medical history, genetic information, and recent test results in the blink of an eye. This technology can process vast amounts of data in seconds, data that would normally take doctors hours, if not days, to sift through. This means that diagnoses can be made faster and more accurately than ever before. One of the most important applications of AI is in diagnostics. Take cancer, for example. AI algorithms can identify subtle abnormalities in X-rays, MRI scans, and other medical images, abnormalities that even the most experienced doctor might miss. By detecting these early signs of disease, AI can play a crucial role in improving survival rates. Early detection of diseases means that treatments can be started earlier, often significantly increasing the chances of success. Consider Google's AI algorithm for ophthalmology, which can detect diabetic retinopathy an eye disease that can cause blindness, with an accuracy comparable to that of human doctors. This kind of technology paves the way for faster and more accurate diagnoses, which is essential for diseases that are difficult to detect in their early stages. But that's not all. AI also has the ability to personalize care. By combining medical history, genetic data, and even lifestyle factors, AI can predict which treatments will be most effective for a specific patient. AI serves as a powerful decision-making tool, allowing doctors to make better-informed treatment choices without losing control of the process. The collaboration between humans and machines makes care more efficient and accurate, ensuring that the patient remains at the center. Beyond these physical innovations, technology is also changing the way we approach mental health. Where mental health care was once often limited to in-person consultations, technology now opens doors to new, accessible solutions. Think of AI chatbots and online therapy platforms that make it easier to seek help. For many people, this is an important first step, especially if the barrier to seeing a therapist is too high. Virtual reality, VR, is also being increasingly used. With VR, people with anxiety disorders can learn to cope with their fears in a safe, virtual environment. This happens at their own pace, without being immediately exposed to difficult situations in real life. Imagine someone with a fear of flying putting on a VR headset and experiencing a virtual flight step by step, from boarding to takeoff. Through this controlled exercise, they can gradually build confidence to fly for real. New devices, such as wearable EEG headsets, also play a significant role. These can measure brain activity in real time, helping to tailor treatments more effectively to the patient's needs. Picture a person with severe depression. An EEG headset can measure their brain activity and help doctors determine which therapy or medication will be most effective more quickly. For millions of people still waiting for help, these innovations offer new hope. Mental well-being is becoming increasingly important, and technology is making care more accessible and effective. Moreover, we see a growing trend in technology enabling people to take better control of their own health. Wearables like smartwatches and health apps make it possible to monitor daily health data, such as heart rate, stress levels, and sleep quality. This data can be shared with doctors or specialists, leading to better preventive care. For someone with a heart condition, for example, a smartwatch could provide an early warning of an irregular heartbeat, potentially preventing serious complications. This underscores how technology not only responds to illnesses, but also helps prevent them. Another exciting frontier is the use of blockchain in healthcare. Blockchain technology offers a secure way to store and share medical records, ensuring privacy and reducing the risk of data breaches. Patients can have greater control over their health data, deciding who can access it and when. This is particularly valuable in a world where cyber threats are on the rise, and trust in data security is paramount. While these innovations are promising, they also raise important questions. How do we ensure that these technologies are applied fairly and safely? Who has access to these advanced technologies? Will these innovations be available to everyone or only to those who can afford them? And what happens to privacy when AI is used to analyze vast amounts of personal health data? Additionally, what happens if AI makes mistakes? Should we fully trust machines, or should there always be human oversight? These questions are crucial to consider as we move toward the future of healthcare. The future of healthcare is being shaped every day by these breakthroughs. What is your vision for these developments? Share your thoughts, and let's work together to consider how we can utilize these technologies in an ethical and inclusive way. And don't forget to subscribe to our channel for more in-depth explorations of the technologies that will change our world.